Hello, everybody. My name is Marianne Brodmann from Graz, Austria, and I have the pleasure to present data of TES drug-eluting stents in real-world lesions. I want to say thank you to BK for the invitation to join, at least virtually, to this great New York meeting he is always organizing. Real-world data for new technology. Why should we look for real-world data and not be content with RCTs? In my opinion, RCTs usually exclude a huge number of patients as the clinical and even more importantly in endovascular, the angiographic inclusion criteria are not met. So patients with complex lesions we face on a daily basis, they are excluded. I just want to name a few examples: multi-level disease, CTOs, or calcified lesions. So what we need is an answer for every technology in our real-world circumstances. We have that in the meantime, real-world data for new technologies. For example, when we rely to drug-coded technologies for many of the TCP technologies out there. I just want to name one example. This is the IMPACT Global Study presented at CSA this year. When we come to drug-eluting stents, not that many real-world data are out there. I just want to highlight real-world data on the most relevant and the most actual drug-eluting stent, which is, in my opinion, the Eluvia drug-eluting vascular stent system. It's a low-dose paclitaxel-coated drug-eluting stent. And I just want to show you here the overview about the Eluvia TS program, the evidence progression starting from the Majestic trial, which is the first in human trial, going on to the Imperial RCTs, which was the first TES trial comparing one drug-eluting stent against the other one, the Eluvia drug-eluting stent compared to the Silver PTX stent. Now, in this Imperial RCT, we have some kind of so-called, I would name it, real-world experience, because the Imperial RCT also had a subgroup including the Imperial long lesion subgroup. We have here 50 patients included, and we see that we have primary patency rates up to 12 months with a really good primary patency rate of 91%. There's also another data set which has been recently presented at Viva, the Eminent trial, which is comparing the Eluvia stent to bare metal stent, and the really real-world large registry which is ongoing is the Lesions registry. It's an ongoing up to 5,000 patients multi-center registry for Ranger DCB and Eluvia TES, and this is real-world evidence as it should be. So just let me show you some data. Just with regard to the Majestic trial, primary patency at 1 year, 96.4%. That was very encouraging. So we did this comparison with the Imperial. In the Imperial RCT, head-to-head Eluvia to Silver PTX, and you see the outstanding result of the Eluvia stent at 1 year. And in the Eminent trial, which was just presented by Young Graphic at Viva, once again, you see the comparison of the Eluvia stent system to bare metal stent. Once again, outstanding results for a drug-eluting technology. And now I can show you here on this slide really real-world data. We have it, as I already have mentioned, from the Imperial long lesion subcohort, single arm, multi-center, and global. And you see here that in really long lesions, and also 1/3 of the lesions were CTOs, we have a great primary patency at 12 months of 91%, and also sustained primary patency at 24 months of 77.2%. But the real world data so far we have from this technology are from the Münster registry, outstanding long lesions of nearly 20 centimeters, around 74% total occlusion, so what we face in real world. And we see here that the primary patency was 90% at 12 months and 71 at 2 years. And in the Auckland all-comers registry, where we also had nearly 50% of CTOs, once again, a really good, outstanding primary patency up to 2 years. And in the retrospective single-center analysis, the Desfinado study, 84% primary patency at 1 year, and once again, long lesions up to 20 centimeters. So this is what we face in real world. We have some issues, or we might have in our thoughts some issues, if we can really apply this drug-eluting stents to real-world patients, because we always fear this halo or no halo sign or halo sign, where we fear that this might count for a higher rate of clinical-driven TLR. And we see here the analysis from Young Graphic presented at Weaver from the Eminence study, showing even if there's a halo sign, there's no higher clinical-driven TLR rate. So we might have also real-world data from the Saval clinical study, which is in the meantime right now a randomized trial comparing the Eluvia stent, the drug-eluting stent below the knee with PTA below the knee. And maybe we also might have some subgroups out of this study which show real-world data. And then there's the sports study comparing in a prospective multicenter randomized way the Eluvia TS to the sequent balloon-coated technology and to a 19 stent. So I think there is really a lot of data coming up to our notice, and I hope and encourage everybody who is the PI of these trials also to look for a real-world data set to show if we can apply drug-eluting stents to our real-world patients. Thank you very much for your attention.